Welcome to Planetary Health First, Mars Next. It is going to be an amazing journey today.
Good.
Hope you are ready for liftoff. We are live now.
Awesome. Well, it is an awesome day. We are back. It's been a while. We took a little latter part of the summer off, and we are energized. Welcome to Planetary Health First, Mars Next. I am Michael. I am the managing director at DeSanti. And when I'm not doing that, I'm doing Planetary Health, connecting with some amazing people. Today, we have Gurdeep, and he is a pharmacist, and you probably have a PhD. You're working on it. But tell us a little bit about yourself, Gurdeep, as a pharmacist, just a little bit about your background before we start on our topic today.
Yeah, Mike, thank you for having me. I'm excited to talk about pharmacy and population health here. Just first, before we go on, I just want to say disclaimer, all views are my own. My name is Gurdeep Sareen. I am a pharmacy director for Optum Medical Tri-State, the Tri-State region. Optum Medical is a multi-specialty medical group, and the region which I'm responsible for is the Tri-State, which has about 2,000 doctors, and we serve about 1.6 million patients. And in that role, I'm responsible for pretty much everything pharmacy, but I focus a lot of my efforts on how do we use medications more effectively, not more, but more effectively to keep our patients healthier and to keep them out of the hospital.
Yeah, that's a big topic we'll be diving into, I'm sure, with out of the hospital. Pharmacy and digital technologies and its impact to population health. That's kind of what we're going to be driving home today on our topics. And so do you want to just unpack that a little bit before we dive deeper?
Yeah, I mean, that's a huge area to get into, but really the way I see pharmacy, digital technology and impact on population health is, in a synopsis, that it's completely revolutionizing the industry. It's allowing for, and it will continue to allow for expanded access, improved outcomes, allowing clinicians to really provide the care they've always wanted to provide, while also addressing the shortages. There's no way that we can always see a patient every aspect of their life, but digital technologies, from everything from your phone to your Apple Watch to different other platforms, can really help improve outcomes care.
All right. So how do you see the field of pharmacy evolving in the next 5 to 10 years? What are we going to see? Are we going to see Star Trek pharmacy? What are we going to see?
Well, yeah, pharmacists, they're going to shift pretty much from right now a primarily dispensing role into a more cognitive service function role. And the role of that pharmacist, the value of that pharmacist will expand and be recognized more formally through expanded scope of practice, through reimbursement. And really with the drivers of this, it's inevitable, right? So we have provider shortages. We have these digital technologies that we're going to talk about today. And we have this overwhelming amount of data showing that pharmacists add a lot of value to improving outcomes. And then finally, you have this huge number of drugs, and the number and cost of drugs in the United States are staggering. So how do we manage this? This is going to shift pharmacists away from their current product base to more cognitive services.
So tell me, what is cognitive services? That sounds like I'm getting therapy right now.
Great question. So cognitive services can be a variety of different things. I'll focus on a few, but it can be from providing medication therapy management, which helps people understand, hey, what are the barriers for you taking this medication? What are the ways we can solve those barriers? Can we maybe provide a refill for your medication? Can we change dosages to make it more easy for you to take. Those type of things, ordering labs, providing naloxone over the counter, vaccinations. And I think in the future, with digital technologies and digital therapeutics, there may be an opportunity for pharmacists to actually prescribe digital therapeutics, because they'll know that, hey, this patient isn't tolerating this drug or is having trouble adhering to this drug. They may be a candidate for a smart pill, or they may be a candidate for this adjuvant treatment, which is digital. So that could be something that happens in the future.
So I'm hearing a lot of like in the cognitive, say it again.
Cognitive services.
Okay, cognitive services. In that, I see a lot of extending, like being a healthcare extender, really like using your awareness with the tools you have and the information, and like filling those gaps of care, sort of as part of that stream of delivery of care. And it seems like right now our healthcare system, I mean, it's not a mystery, it's broken. It's really badly broken. So I guess what you're trying to be optimist, right? So you're leading the charge on this. You with going forward, pharmacists can be a big link, a driving success factor in delivering better care. I have a weird question. I know we have some other questions, but where are pharmacists in where the medications, I know you're at the point of when you're delivering it with the doctor's orders, but what about in the actual, when they're discovering medications, like you're given XYZ, let's say Lipitor.
Yeah.
Where are you? Like, it seems like they want to give everyone Lipitor that's over 45. Like, tell me, like, where do they get that data? And I'm sorry, I'm going off cuff, but I feel like, if you don't, my gosh, you're not being compliant. But where can like, and let's not necessarily use a Lipitor, but I would love to, maybe we could, but where a pharmacist comes in to help educate that patient to alternatives, because it just seems like doctors' time is limited, and it's always, anyway, I'm going to stop there because that's a lot to unpack, and we're getting off track, but that's what we're here to do.
That's absolutely fine. So when you're told to take a Lipitor pill, and listen, no one likes taking medications, but some of these medications, like Lipitor, which is a category of drugs called statins, they have proven evidence to reduce mortality, reduce your chances of heart attack. And that's why it's highly recommended to take a statin. So this is why your doctor tries to push it, to suggest it strongly, because they know how effective it could be. The unfortunate thing is a lot of these medications, you feel the side effects, but you don't feel it working. So if you only feel the negative, you don't feel the positive, as a patient, you're like, why am I even taking this? But it is working. There are some serious side effects which you should, if you experience, talk about with your doctor. But generally, it shouldn't be something you discontinue without having that conversation, because there are a lot of different possible scenarios that could be happening besides it being that specific medication or side effect from it.
Well, back to the topic. What is population health as we go forward in this whole digital therapeutics, digital technology? What is population health from a pharmacist standpoint?
Yeah, so first, population health, just as what population health is really the outcomes of a group. And it could be something with similar characteristics, like, for example, A1C control in patients with diabetes. Now, organizations then take this information, they stratify it, they use it to engage their patients, to close gaps, improve outcomes, and coordinate care. And why this is really important in pharmacy is because the cost and the number of drugs have become staggering. In 2021, the United States spent about $600 billion on just prescription drugs that we have on record. And that's, so if you want to just get context of that, that's about 18% of healthcare spend, which is about 18 to 20% of total GDP. It's pretty staggering. Pharmacists like myself spend 6 or more years. So 6 years is just to get your degree, plus possible residencies, to become experts in drugs, from the clinical aspects to the financial to the operational aspects that really help drive value. So as these drugs continue to increase in cost and number, pharmacists are really best positioned to collaborate with other healthcare professionals to manage that spend.
So talking about spend, so if I hear you correctly, I'm not a mathematician, but you got 18 to 19% of our GDP total healthcare spend. And are we saying then if you do the 18% of the of the total healthcare spend is the pharmacy spend, are we talking like 3 maybe percent of the GDP is pharmacy spend, or something like 3 to 4%?
I think that's about right. So around 3 to 6%. I'm not a mathematician either. So definitely, it's definitely pretty staggering.
Wow.
Medications being that expensive, and it's only getting more expensive. You see these drugs, they're more and more precision-based drugs, which are very specific, which would limit side effects and improve efficacy, but they're incredibly expensive.
So if pharmacy is like 18%, what I should know this offhand, but what is the hospitals? Do you know? And I guess we could fact check it, but what's about the hospital spend? Do you know?
Oh, I actually had to double check that. I'm not really sure, but somewhere around, I want to say 15 to 20%.
Okay. So those are the big factors driving the cost of care. So those are the two factors. So then again, getting back to population health is figuring out the pharmacy medications, the best medications, the right medications, and then avoiding hospitalization is really the goal. If you're looking at it, would be population really, and delivering the best patient care, I would imagine.
Yeah, exactly. And just to add to that a little bit, it's not about what's the most lowest cost drug. It may be more appropriate to spend more on a drug to avoid a hospitalization. In fact, many times it is. And that's the shift that we're having from, oh, this drug costs $1,000. Okay, if there's another drug that costs $100, but the one that's $1,000 prevents you from going to the hospital, that's the better choice. That's actually the most cost-effective drug.
I would imagine sometimes that's hard to find out that data. It seems like, and maybe it's easier, I mean, so, with some of those things, it's simple that the costs are just way too high. I mean, I know something about what's that new medication for low, obesity, or, that's lowering it for diabetes. And it's like everyone wants to take it and lose 30 pounds. And it's like $1,600 a month. And I think Elon Musk wanted to take it, and you can get it for $60 or something in Europe or something. I mean, it just seems crazy about that kind of stuff with the difference. But anyway, that to me seems a little odd how that unfortunately is, but that's America. So where does pharmacy fit into population health?
Well, exactly. Like, if you want more examples of how they actually can contribute to improving population health, there's so many of them really, but I'll focus on a few. I kind of alluded to it somewhat before. So one is medication errors. So medication errors are one of the most common reasons for preventable hospitalization and ER visits. So pharmacists conduct a process called medication reconciliation to identify any errors such as omissions, contraindications, or duplications in therapy, which have been known to cause adverse events and lead to hospitalization and ER visits. It's a pretty lengthy process, but because we're experts at medications, we're well positioned to do this type of service.
So do you guys have the time to do that? Where do you do that? When do you do that? It seems like that would be really tough to get that right. I mean, is there reimbursement for the time necessary to get that right?
Yeah, that's a great question. There is reimbursement in some scenarios, not always. Time is always difficult. Pharmacists are not a cheap resource. So a lot of organizations struggle with having pharmacists do MedRec at scale. There are digital health companies that do help support MedRec to make it more efficient by using data sources and things like, scanning vials to actually pull that data, find out what drug that is. So a patient can actually scan all their medications and it populates into their list of meds. And then someone actually can review it and say, all right, based on this, I see what you have. Based on your claim, I see this. Based on your hospital list, I see that. And they can work with the providers and the patient to see what's the right thing that the patient should be on.
Yeah, a good example is my, father. Both my parents are elderly, and my dad's 90, and so my mom often takes, every so often, I don't know, probably every week is going to the pharmacy. I could imagine, right, for both of them. And I keep on telling her, tell the pharmacist you need some UTI, cranberry, or whatever, and they'll know what to do. And she keeps on forgetting, and I'm the bad son. I should just do it. But to me, that's like just one of those things that is part of the treatment plan, but it goes passing in the night. I mean, I don't know how many UTIs, but he's highly acceptable to it. And so that to me is where I guess you would, even though that's not a medication, but a lot of those are, I mean, isn't that under under the pharmacist preview, would you say, those sort of things? Like,
I could say yes and no. I mean, right now the environment's all based on, hey, fill these scripts. I do think that, yeah, if you see a patient who may benefit from it, it could be an opportunity. But right now in scope of practice, I mean, it's over the counter, so you could provide it. It is not something, unfortunately, that pharmacists get a chance to step outside, see the patient, provide that intervention. Imagine doing 1,000 scripts a day. It's overwhelming, and that's.
I'm surprised because I'm really surprised when you think about it, though, with like the pharmacy, the point of retail, they wouldn't do that. There's so much money that they could be. I mean, my gosh, to have another vitamin or filled at the point of a location. So I don't know. It just seems like maybe Rite Aid. If Rite Aid would have done that, they'd still be in business, right?
I mean, we definitely do our best in the environment we have. I know that pharmacists are always eager to find opportunities to help patients as much as they can. Sometimes, unfortunately, we just can't be as engaged as we want to be. And digital technologies might help change that.
And I didn't mean to be like, I was kind of kidding, but Rite Aid, like, hey, can we supersize this with you? It's like, but anyway, can we do a better care plan for you today? What are the biggest challenges that the pharmacy industry faces in promoting population health?
I mean, just back to our previous point, we have other aspects that could, we can address things like improving adherence and outcomes and vaccinations that help really improve population health outcomes. But some of the biggest barriers, again, are our scope of practice and reimbursement. I'd say those are the two biggest ones for pharmacists specifically. In some states, we're not even considered healthcare providers, which is kind of alarming and sad. We're pretty limited in our scope of practice, and we don't always get reimbursed for all our services. Now, this is changing dramatically. So the law of states in the past, year, few months have made amazing changes, but we still have a long way to go. And so I think once we address these areas, pharmacists can shift from their current roles to more of a patient-facing cognitive role.
So with this, so what do you see, like, if you could, like, basically, I hate to say wave your magical wand, or if you could, if you could see if pharmacists could do what you like what would that look like?
Ideal world?
Yeah, in an ideal world, to extend your scope of practice, like where would that be? What would that look like?
Let's just focus on the community pharmacy aspect of maybe community pharmacy and patient-facing aspect of pharmacy. So I think in certain scenarios, they can, look at the patient or have conversations with the patient about the medications they take. First fill, always have to ask questions. Hey, do you have any questions? Oh, these are some pearls about the medication. Don't take this antibiotic with, for example, milk because it interacts. Sadly, I don't always hear that being said when I pick up my med, right? That's a base. But as scope expands, identifying any adherence barriers and solving for them, being able to work with the provider and some type of agreement to order labs, order refills, titrate, and even change medications based on guidelines. It's not, as they wish, but there's certain conditions, chronic conditions, that have very straightforward guideline-based treatment. And I think pharmacists could help improve access to prescribing meds and changing meds in a timely fashion. Also, just making sure that they're able to prescribe rescue treatments, which in some states they're over the counter, sometimes they're not. So just being able to do this type of thing will be really important.
What's rescue treatments?
Good question. So, for example, naloxone, which I believe in many states, if not all, is over the counter, or glucagon, which is for low blood sugar, which can actually send you to the hospital. Naloxone, as many people know, it's for opioid overdose and can send you to the hospital as a result. So those type of things would be really valuable for pharmacists to be able to do. Vaccinations for people, because pharmacists are the most accessible healthcare professional, and even where they're deserts for doctors' offices, you can often find a pharmacy. Not always, but often. So I think being able to vaccinate people and support those public health efforts will be really valuable.
So I thought they were able to do that now. Is that help me better understand that barrier for pharmacists vaccinating? What's the challenge right now?
They are able to vaccinate to certain levels, certain extents, and be reimbursed. But I'm just saying in general, those are important aspects for them to have.
Okay.
Yeah.
All right. Well, fascinating. Can you discuss some examples of successful population health initiatives led by pharmacists?
Yeah, sure. So kind of like what I was talking about before, pharmacists can do medication reconciliation, which can reduce med errors and preventable hospitalizations. They can also help with medication adherence and disease outcomes. So the only medication that works is the one that they take, but only 50% of people actually take their medication as prescribed. So this is pretty concerning, since often we look at adherence as a indicator for eventual disease control. So if you're not taking your medication, your disease may not be controlled, and that may lead you to the hospital or worsening condition, and so on. So pharmacists are able to assess and address those adherence barriers. And as I said to you before, in some scenarios, they are able to adjust and titrate drugs. They're able to order labs and medications, and this allows for improved access, improved patient experience, and actually is shown to have a 4-to-1 ROI. So for every $4 you invest, you gain $4 back.
It seems like they don't want to spend any money. That makes sense, though, right? I mean, isn't that the whole thing? All the education, all those signs. I mean, it's just unfortunate with all that information. There's just a reluctance, right? I mean, to to spend money where you actually might get money back, right? We're in a fee for service model, even though we talk about value based, right? Seems like there's a challenge, right? Is that a challenge with the insurers? What is that, the challenge? Why don't we want to invest more money to get better preventative care and help on those things?
Yeah, so I think any change like that takes time. And as I said, that there have been significant changes, and states, Medicaid, saying we will reimburse the pharmacy services in different scenarios. So things are changing. I think it just takes time, and really the proof is in the pudding to show, hey, pharmacists are really doing a lot, and they continuously do so. So I think as time goes on, as we said, like 5-10 years, I could definitely see more and more states, maybe even nationally, pharmacists being reimbursed for some of the services they provide.
Yeah, I would hope so. You guys do so much. Patients know their pharmacists better than their doctors, I'm sure, in many ways, the good pharmacists. But you guys are so busy, then there's the barrier too, unfortunately. Like you said, 1,000 orders or prescriptions a day. Probably a lot of burnout. But let's go on to digital therapeutics. This is a really, I know you get really excited. You probably have dreams at night about digital therapeutics.
I do have a real passion and interest in digital therapeutics. Currently, you look at digital therapeutics what digital therapeutics are first. So currently you have medications, and they have different dosage forms, right? So they can be a tablet, a pill, a cream, an inhaler, et cetera, et cetera. So there are different dosage forms to deliver a therapeutic intervention, the drug, right? So all of these, though, come with some level of side effect, risk versus benefit. And that's known part of prescribing meds. Digital therapeutics, however, they are a software that delivers a therapeutic, evidence-based treatment to patients. So this is without side effects. There are barriers, but there are without side effects. And so one example of this is ADHD. So right now, ADHD is often treated with stimulants, which are addictive. They have their own concern as a controlled substance. But there is a digital therapeutic which uses a game to treat ADHD. Now, I would much rather, if my child has ADHD, let them play a game than put them on a stimulant.
No, that's a great example. So how long does this kid get to play this game? What's I guess it depends on the level, the dose of the game. 5 hours a day. The kid's doing great. He's not bouncing off the walls. This works. He's on it for 5 hours a day. He's doing great.
Every waking moment, he's playing the game.
Yeah.
And that would be interesting to understand how much time it takes for that therapeutic intervention to actually work. That I don't know, but that's a good question.
Well, I think statins take 6 weeks, right?
Don't quote me on how much time it takes. I don't really know offhand, but it can take a little time for it to work. There are many drugs that take about 6 weeks to work. Antipsychotics are one that often takes 6 weeks to work. So I'm just not so sure exactly on the statins.
Yeah, a dog is great. I tell you, you have mood issues, get plants, get exercise, and get dogs. I think that should be in the treatment plan too. And play video games. Right?
That's the kind of treatment I like. Absolutely.
Yeah.
You can't really be unhappy when you see a cute puppy, right?
Yeah, and plants. I tell you, I went the other day. My wife has gotten really into gardening, and we went to the nursery. And I tell you, I cannot tell you. I was trying to figure it out, and then I'm like, you know what? I'm in this greenhouse, and there's just so many different plants. There is something there, and maybe it was just coincidental. I don't know, but I really think there is stuff to that. But anyway, this is kind of off topic. That's what I do to try to, we are planetary health first, Mars next. At this point in time, we are here on Earth, and I would say, just like there is a future with digital therapeutics that will be 30 years, 40 years, and it will probably be treating people in Mars. So anyway, how do you think digital health technologies will impact the pharmacy industry and population health? I know these are similar thoughts questions we've had earlier, but if you want to take a stab at that again.
Yeah, sure. So really the way I see digital technologies impacting pharmacy and population health is completely revolutionizing that industry, and or will, because I think it's slowly happening. But I think there's probably about 5 crucial ones that I can think of, but there are likely also a lot more. So in medication adherence and disease state management, they have these smart pills and bottles technologies that provide a precise adherence measurement, which is a big improvement versus current standards of care. So right now, either you have to count pills, see your patient, and you'll count the pills, did they take it or not? Or on a population health level, you'll use something called proportion of days covered. The proportion of days covered is based on claims, and you really have no idea, is the patient actually taking the medication? Just that there is a paid claim for them taking it. It could be sitting on the pharmacy shelf, it could be sitting on the patient shelf, it could be in the garbage, who even knows? So if you have these more precise measurements, you can more accurately determine, the patient's adherent or non-adherent, and act accordingly. So, but granted, this is going to be way more expensive, well, not maybe way, but definitely more expensive than the pill alone. So the question that individuals have to ask is, when is it worth it to pay that extra amount? If, for example, for patient it has chronic heart failure, it may be really worth it to pay an extra $200 a month to make sure we can track adherence and intervene. That's a question that we have to ask in the future, because we will be able to measure. Another area that I think of is identifying treatment success or failure. So right now, practicing and prescribing medication is really an art form, and science, but art as well. And there's inherent risks and benefits. So some people may have more side effects, risks, than others, but we don't really have a way of knowing that in many scenarios. Advanced digital technologies, which are powered by vast amounts of synthesized data, will eventually, not now, but in the future state, be able to predict individualized drug risk benefits. So patient John Smith comes in, and that digital technology knows there are 500 other John Smiths or individuals like John Smith. They'll say, well, this drug is more appropriate for this patient because based on all the data I have, they're more likely to not have side effects and have desired outcomes. So that's really, really interesting. But I think we're a little away from that.
Is that getting into what we've been hearing, this digital twin? Is that what we're getting into, where you, I know there's something else that's more like big pharma trials where you have all the different, I guess you can, on a computerized model, you can create what would be, I guess, a model that you could then test without actually giving that patient the medication to test. I don't know. Anyway, that's way over my head. But I thought that was sort of what I was hearing, a little bit of that same concept there with the digital therapeutics, where you're eliminating the side effects and you can really use precision medicine, I guess, under that category. Maybe that's the category. And I'll stop while I'm ahead, and let's get back to what advice would you give young, aspiring, excited students, future pharmacists about population health and digital therapeutics? What should they do? What should they study? What can you do to help these people to steer them the right way?
Yeah, so I think there's a lot of general recommendations here, right? So one is be eager to learn and find every opportunity to do so, whether it be a project at your current job, or a rotation, or a unpaid side project gig that you can do. Whatever you can do, try and do it. You never really know when that opportunity knocks, but you need to have experience. So experience is often more worth it than just the money, or just the, hey, I got paid X amount of dollars to do a project. Sometimes when you don't have experience, you just have to do the work and show the value. So I'd be eager to do that. I'd also try and find a mentor who is doing work that's similar to the type of work you want to do. But key thing here is not to be too pushy, but more ask them for any advice or recommendations, and eventually try and build a relationship. And if that individual is willing and able to be a mentor, they will. It does take a lot of time. It does take a lot of effort. Someone has to be really passionate about doing it and having the time to do it. So it's just important to keep that in mind. I think probably one of the most important things, though, is taking all setbacks as opportunities to learn. So there's been plenty of times that say, I'm interested in digital therapeutics and digital health. I want to learn. I'm not able to find anyone. No one's responding to my LinkedIn's. Keep on trying. Learn from whatever your mistakes were and keep on growing from that. And yeah, I think those are my main recommendations on getting into the space. There are a bunch of different certifications as well, which are available through different colleges, and I think on LinkedIn there are a couple as well.
Well, that seems to be helpful. I really like the way you shared about mentorship. I think mentoring is hugely important, and it's like a give and take. A good mentorship, the actual mentee and the mentor should be receiving both almost equally. So yeah, I think that's the hardest thing, is to really find the right fit too. But I think that's tremendously important. Anyway, we're kind of coming towards the latter part. I do want to open up, continue. Is there anything that you feel through this conversation that's kind of been bubbling up to the surface in your thoughts that you'd like to just shout out on Planetary Health First, Mars Next? Any sort of thoughts that you'd like to share with our guests, our audience?
Yeah, so for me, a lot of times people wonder, are digital technologies going to replace healthcare professionals? And in my personal opinion, no. I think it's actually going to help us evolve. It's going to help us address shortages. It's going to allow us to provide the care we've always wanted to provide. Looking at the patient outside of the walls of our healthcare institution, because right now we don't really see them outside the healthcare institution. There's limited visibility, whether they go to the pharmacy or they go to an outside healthcare institution or they're at home. Digital technologies can help us, for example, sense elevated heart rates in a patient very early and treat them early on. So I really think that digital technologies offer us an opportunity to evolve and to really help our patients in ways that we haven't been able to help them before, in ways that we've always wanted to provide before.
Is there any organization that you're active in, that you're following closely with digital therapeutics, to kind of keep on the cutting edge of legislative, regulatory, informing yourself as a pharmacist?
Right now, mainly I work and I am part of ASHP and AMCP, which is the American Academy of Health System Pharmacists and American Academy of Managed Care Pharmacists, to keep on top of things. There's another one that I'm trying to remember the exact acronym, but they work in basically the intersection of augmented reality and medicine, which is really interesting. I just can't seem to remember their acronym, but once I do, I'll write in the comments once this is posted. But really just trying to understand, where is technology being used, how is it being used, and trying to keep active in different digital health conferences. So I know Columbia does one, and a few other ones do them. So I try and keep active there.
Well, Gurdeep, this has been great. I really like your, it's obvious you're passionate about your work, your profession. And I think, especially towards the latter part of our talk, you brought up, what you could do to encourage students. I think that's really great to hear from you. I think I get the feeling we're not sensing that a lot with all pharmacy and pharmacists. There's a lot of burnout, and I think the same with clinicians. I get a feeling that a lot of them are leaving, and so it's really encouraging to hear you be kind of a model for those. And I think everyone wants to go into something and do things well, and it's good to hear that you're doing that.
Thank you, Mike. It's been a pleasure.
Well, this is great. We're going to we're not leaving Mars yet. We're still in Earth, and we're kind of wrapping it up. And with that,
friends, it has been a great journey today on Planetary Health First, Mars Next. Follow us for more on Planetary Health First, Mars Next. Until next time, peace be with you.